So let me start. Firstly, I will discuss with you quickly the presentation objectives. We will discuss today the difference between the adaptive seating specialist and the equipment supplier. We will get overview about the 24-hour postural management and the timing for postural care, when we should advise the child to start his postural care, and what are the proper seating benefits, and what are the signs that I can say that this child need a wheeled mobility. And we will also discuss the out-of-dated 90-90 standard rule, which is saying that if you want a child to be active, you should put him in a 90-90 position. And we will get a quick overview about the parent interview and the assessment. So let's start initially with the difference between the adaptive seating specialist and the equipment supplier. The adaptive seating specialist, he is a healthcare professional. Usually, he's a physiotherapist or occupational therapist or certified assistive technology practitioner. And he's responsible for three things. The first is evaluation for the individual with postural and mobility impairment. The second is the recommendation of seating and wheelchair system. And the third is teaching the wheelchair user and the caregiver how to use this chair and how to transfer in and out of this chair. But for the equipment supplier, which is, I believe that we have here in the UAE, a lot of companies with a lot of vendor representatives. So usually they are technical specialists or vendor representative. They are responsible for the fabrication and the technical support of the wheelchair or the seating system, including the maintenance check and repair and the gross modification of the chair itself. So the best approach is the collaboration between both of them to get a fully adaptive, functional seating for the wheelchair user, which is allowing him to participate in his daily activities. So before we get into the seating adaptation, we need to know where it comes from. Actually, it comes from the 24-hour postural management, which is a holistic approach used in the rehabilitation and management for individuals with movement disorder to support their body alignment and function. And it involves mainly 5 things. The first, of course, is the adaptive seating, including the molded wheelchair and supportive chair. Second is the orthotics with its different type, like the FO, Grafo, brace, spinal brace, and all of this equipment. The third is the sleeping system, which is mainly used during night time to prevent any deformities. The fourth is the standing frame to support the upright positioning. And the fifth is the showering equipment, which is also, we have specialized equipment during shower time. So the question now, when should we start the postural care? Let's say the golden standard that the early intervention is crucial for the healthy development and prevent any deformity. So if the child reach the developmental age without catching the developmental milestone, then we can start advising the postural care. So after the age of 4 months, if the child cannot lie symmetrically, we can advise sleeping system. At the age of, or after the age of 9 months, if the child cannot sit, we can advise with the seating adaptation or adaptive seating. And after the age of 11 to 12 months, if the child cannot stand, we can advise with standing frame. And of course, all of this prescription, it will not come alone. It will come with specific physical assessment and parent interview, and you need to know all the picture of the child so you can decide what kind of equipment he needs at this time and why he needs this equipment, so you can expect in the future what will happen. So let's talk about the benefits of the proper seating. As we all know that most of the children with neurological disabilities, they have postural asymmetry, they have muscle imbalance, they have high tone, they have even musculoskeletal problem, they have a lot of problem. So when we give the child, or the chair gave the child, enough support with the pelvis and trunk and head, it will improve the alignment, the mechanical alignment of the child. And of course, it will reduce the risk of deformities like scoliosis, kyphosis, and of course, it will prevent the pain and the skin breakdown. Also, from a functional point of view and from different perspective, when we give proximal stability over the trunk, it will improve the hand use and the eye-hand coordination and the vision. It will also enhance the fine motor control during the educational process. And it will also supported by research that it will support a safe feeding process through a good alignment. And at school, of course, when you feel comfortable, well supported, you will have a good attention. You will have a better confidence and better independency. And let's say it's something normal for anyone. You cannot shift your mind if you feel pain. Like right now, when I'm presenting, if I have pain from my sitting position, either I will change my position, okay, or I will stop thinking in what I'm presenting and I will think about my pain. So definitely it will take from my concentration and my attention. So imagine this with children at school. So of course it will affect their daily living activities. So the question now, do we have signs where we can say that this child need a wheeled mobility, like this child need a wheelchair or not, if we don't know? Of course, the first thing, if the child is not ambulatory, like let's say the child is GMFCS level 4, at this stage, we know that this child will need a wheeled mobility. Or if he has some safety concern, like if he can use the walker, but he cannot control the walker, he does not have the awareness for the direction. So at this stage, we need to say that he needs a wheelchair or a wheel mobility. If he take too much time to transfer through walking or using walker, let's say at school, most of the children, they need to move from one class to another one. Or, for example, they have the evacuation test. So they need a certain time to reach from one point to another point. If the child cannot match this time and it affects his participation and functionality, then we need to prescribe a wheelchair. Or if he spent a lot of effort, which is again will affect his daily activities and environmental participation, then we need also at that time to prescribe a wheelchair. So right now, this is something, an area of debate, honestly, because in the past, they teach us uh, if you want the child to sit actively and to participate in what he's doing, he must sit in a 90 trunk in relation to the side and 90 thigh in relation to the leg. But right now, my question for everyone, can you describe in the chat box your sitting position, like your alignment right now? And does any one of you sitting completely in a 90 degree? And if for how long you can maintain this position without shifting your body, without moving your body away or changing your position? Because it's also supported by the research study and the practicality that you cannot maintain this position more than 10 to 15 seconds, and then you will tend to shift your body. Okay, let me explain why. Because when you are sitting completely in 90-degree, you're putting direct weight over the ischial bone, which is again putting weight on your soft tissue and preventing the blood flow from this area. Then your body will give you alarm saying, hi, I need some blood flow. What is this alarm? This is, we call it pain. So you will feel pain, you will feel itchy in this area. Then you will tend to shift your body and change your position. This is normal for anyone, for any healthy uh, individual, and supposedly you don't have any contracture or joint tightness, you don't have any spinal curvature like scoliosis or kyphosis, you don't have muscle weakness or um, hypertonicity or lower tonicity. So imagine that most of the children that we are dealing with, they have one or two of this minimum, one or two of this problem. And if you force this posture, you can cause more pain and more pressure and more skin breakdown. You can lead to more skeletal deformity. And I'm very sad to say that I saw this before. It happens actually with one of the kids. He had um, muscle asymmetry in his trunk and he has hypertonia. And the adaptive seating specialist said that he need to sit in 90-degree to be more active and to activate his muscle and to activate his core muscle. But what happened that after 6 months, the curve of the spinal asymmetry and the scoliosis increased dramatically. Why? Because this boy has postural hypotonia and muscle weakness. So he can maintain this for a very short time. But after that, what he will tend to do, or what actually he did, he goes into collapsion of the collapsation of the trunk. And then with the asymmetry, he bended his body to one area. So the scoliosis increased within 6 months dramatically. Why? Because of his position. So the modern best practice says right now that we need to accommodate fixed deformity rather than attempting to fully correction and pushing for a full correction. We need to support the posture through pelvic positioning build and the lateral support of the trunk, and use the adjustment of the chair, like the tilting in space or the reclination, to facilitate the best position for the child. We need to enhance the pressure distribution. We need to encourage at all the participation. So right now, I'm not saying that we should never advise the child to sit in 90-degree, but before that, we need to get the full picture of the child. We need to do a full assessment so we can see if this position is really practical and suitable for this child or not. And even if we need to provide a full pressure relief protocol, and we need to teach the child and his parent how to change his position so he can get the benefits of this position. So one of this complete picture is the parent and the child interview. Right now, I will talk to you about each section, and I will mention some of the key information that we need to get it and why it matters and how it will affect the equipment selection. So, for example, in the medical history, we need to get some information about the age and diagnosis, and if he has different surgeries, even the medication, if he takes some epileptic medication, which is affecting the general stability and endurance of the child, we need to know something like that. Or if he has specific condition affecting his posture. Like, why it matters? Because, for example, prescribing a chair for 5 years old is completely different than 10 or 11 years old child, because the last one, he probably within or he will start the growth spurt. So we need to consider in the chair selection something adjustable with the seat depth and the seat width and the back height. It should be adjustable, okay? And if the child has condition or risk or some diagnosis which is related to easy skin breakdown, then we need to consider a pressure relief cushion. Or if the child has probability of high fatigue, then we need to consider, for example, the tilting in a space chair or stroller. One more thing is the environmental accessibility, which is always something we rarely look. I think the occupational therapists mostly look at this part, the home accessibility and the school accessibility, the entry dimension of the home, the corridor width, and the bathroom accessibility at home. And you're at school, we need to look at the door width, the desk height, and the ramp accessibility. Why? Because we need to ensure that the wheelchair fits and functional for the child daily space. So, for example, if the child has tight home space, so we need to consider a compact and easy maneuverable base of support for the wheelchair. And if the child using his chair at school, so we need to consider either adjustable seat height or tray, so he can participate with his peer. One of the main problem, actually, I've seen it here in Dubai, is the child and the caregiver goal. Like, most of us, and even myself at the beginning, I was always looking for the child, not for the parent. Like, and also it always happened that you prescribe a very good stroller with perfect, everything is perfect for the child, but it's very heavy to be pushed. And this child is completely dependent on his caregiver and on his parent. So when you ask the parent, he will always complain from back pain, from shoulder pain, because he's always pushing this stroller. So we need to align the child goal and the caregiver goal. We need to know the caregiver responsibilities. If he's only responsible for the transfer, for the pushing, for just loading, for just helping the child, we need to know the level of participation of this child. Okay? So, for example, if the child needs or goals are the independency, then we need to give him appropriate wheelchair access and positioning. So we need to consider everything is accessible for the child who is sitting on the wheelchair. But for example, if he depends on the caregiver, let's say very simple example is the brake, the brakes. Some of the adaptive seating specialists, they put only the brakes accessible for the child, not for in the handle for the caregiver. So it's a big problem for them and it will affect the safety of the child. So if also the caregiver is responsible for everything, then we need to consider a lightweight frame and easy foldable mechanism for the chair. And usually in the assessment, we have two, like two conditions. Either the child does not have any um, seating or wheelchair or stroller, or he already a wheelchair user and he used this for a long time. So at that situation, we need to gather some information about the current or the previous wheelchair. And we need to get some information about his postural support and his comfort. And also the repair frequency and why he does not like it. Because we need to avoid the past problem and we need to highlight what feature work with this child or with this person and what did not work with him. Let's say again, if he complained from the poor fitting and the discomfort, then at that time we need to consider a custom molded seat. Or if he complained from frequent repair, then we need to consider a durable and reliable component of the chair. So again, it depends on what he will say to us. One more thing in the parent and the child interview is the self-management, because it's very important to know how the child communicate his postural needs and discomfort. Can he say that I'm not sitting well? Can he explain himself? And we need to know also his physical abilities, his hand grip and hand power for the brake management and wheel propulsion. Because we need to determine the level of independence in the seating management. And we need to know the impact of the long-term postural health and the tissue integrity. Because if the child has limited communication, then from the beginning, we need to consider a pressure mapping and reschedule a frequent repositioning protocol and frequent check of this child to prevent any future deformities. Or if he said that we need to consider the developing self-management, we need to give him accessible control with visual guidelines. Like, for example, if the child has some problem with his vision, okay, and he can manage to propel and to use his wheelchair, sometimes we add different color over the brakes of the wheel so he can visually differentiate it and can use it in different environment with different light. Again, the transportation. We need to get information about the method of transportation and the type and the size of the vehicle. If it's van, low, the height of the chair, to ensure the safety and the how practical this chair in his daily mobility. Because if the parent have small vehicle, then we need to consider a foldable frame with quick release wheels. And uh, if they have a very tight time for transportation, then we need to give them something easy to be released. If, for example, they travel a lot with the stroller, then we need to give them something lightweight and durable as well. So again, one of the main problem here in the country and everywhere actually is the funding consideration. So usually we have three ways. Either it's insurance or governmental or self-payment. And yeah, the first is in governmental or insurance, or the third is the self-payment. Okay, why this matter? Because we need to know the timing and determine which equipment feature will financially will be accessible and they will accept it. Because if the child has limited funding, then we will set the core needs. We will set some priorities for the wheelchair. But if the cover is flexible, then we will recommend everything. Like we will get the child everything he might need it. So all of this simply it happens during the interview. So from this information that we gather in the interview, we will get like overall picture about the child and his caregiver needs and what kind of wheelchair is suitable or stroller is suitable for this child. After that, we go to the next stage, which is the physical and postural assessment. Actually, in this part, of course, we will need a hands-on workshop to demonstrate it more, but I will try to give you overview about it. So in the postural assessment, we check the joint range of motion and the limitation, and we check the muscle tone and the strength, and we checked the flexibility of any spinal deformities. If we need X-ray or collaboration with any of the orthopedic surgeon, we will ask for it before. We will check the skin integrities and the pressure point. And after we get information, physical information, we need to start with the hand simulation. Why this important? Because before, this is the link actually between what we expect from the equipment and what we will advise the child to get in his wheelchair. We need to simulate, like, let's say that I expect that this child will be functional and sitting and he will participate in angle like 90 degree, let's say. So I need to put this child with my hand and adding some detachable cushion in this position and ask the child to practice some activities and to do some movement from this position. And we will see his expression. We will see his communication. We will see his sitting position and his alignment. For example, if we will advise a custom mold cushion, and then we take the mold before we go to the fabrication and the preparation of this cushion, we need to check the child alignment, even with the pressure map. All of this, we 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 call it the hand simulation. After we make sure that what we choose for the child is completely fitting his needs, then we will deliver the equipment or ask the equipment supplier to deliver the equipment. But here we cannot stop at this point, because after the child receives this wheelchair with the equipment, we need to check if he can use this equipment or not, if he can manage to shift his weight and to transfer in and out by himself or with the assistance from the caregiver or not. If this equipment has like multiple adjustment, like the tilting in space, back reclination, we need to teach the caregiver how to use this during his day, during his activities. Otherwise, if you give the child and his parent a fully accessible wheelchair or stroller and he does not know how to use it, then it will be useless because he cannot use any of this adjustment. So for me, after the delivery of the wheelchair or the stroller, it's very important and it's way important for the child and his caregiver to, to get some information about the protocol. So please, if any of you will advise a child to go for a wheelchair, don't miss the last step, because believe me, we saw a lot of international children with their families, and they saw that after they get the chair, they will take it and they will travel. But after a couple of months, when we see this parent and the child again, although you prescribe a very good chair with fully adjustable equipment, you will see that the child has some problem and he's complaining from the chair. And from the second interview, you would know that they didn't use any of the adjustments, like simply the seat belt. We all know that our base when we are standing is the feet, and our base when we are sitting is the pelvis. So if you want basically, if you want a good alignment, you need to start with the pelvis alignment. So when you see most of the caregiver, or especially the nannies, because they transfer the children quickly from the car to the stroller or the chair, and from the stroller to the physiotherapy room, they forget to use the belt. And then they complain that the child is not sitting well. He is sliding, he's leaning into one side. But every time, if you try to check if they did all what you teach it to them, you will find that they always forget something. So one of our part is to always double check and advise the parent if they did not follow the recommendation, what will happen? What would happen if they didn't commit to this? Because again, for me, it's a hidden bomb. Yeah, because you will not see the problem immediately or after 1 month. You will see it after 6 months. So most probably you will not see the adaptive seating specialist. Like the parent will come to Dubai and he will see Mostafa and he will prescribe blah, 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 blah. And then after that, they will travel. After 6 months, they will discover that something is wrong. So this is, from my point of view, one of the most important thing. I believe that the physical assessment and the hand simulation, as I said, it needs a workshop, hands-on workshop where we can discuss how we can proceed into this. Now I will leave you with Engineer Ahmed. He will talk about 3D printed foam, which is again will solve most of the problem that I mentioned here, and it will fit the gap in most of the equipment and the wheelchair. Thank you. And if you have any question, we will have time at the end of presentation so we can discuss everything all together. Thank you.
Thank you, Dr. Mostafa. I appreciate your informative presentation. Thank you very much. Hello, everyone. Assalamu alaikum. This is Ahmed Atef. I'm the co-founder and managing director of Tinta 3D Printing Lab. I'm a product design engineer. My specialty is 3D printing. And now I will take you through the roots of this technology till we get into some details and a quick intro to the applications of this technology into seating and adaptive equipments. 1 second. I think you can see the screen now. So we will be talking about, first I needed to take you through the 3D printing itself. What is 3D printing? For anyone who doesn't know what is this, what's the meaning of this manufacturing technology. So we will be talking about 3D printing itself. Then I will take you in a comparison between the traditional foam and the 3D printed foam, and what is the 3D printed foam, and how 3D printing enters this industry, the very old traditional industry, the foam. And we will take some of the seating challenges with the current seating solutions with traditional foam that have been used for a while for all of the cases and patients. And we will answer this question, which is why 3D printed foam? Why we should use 3D printed foam in seating systems, not only seating systems, but most of the adaptive equipments that can use what we call personalized comfort. And then we will talk about the personalization workflow, how we can make this happen, how we can take this foam and make it a full solution, the flow step by step, and we will stop by each step and give it a quick hint. And last will be some of the applications outside the seating itself and other equipments that mentioned by Mostafa later on. Many of you can have seen this before. I think this is one of the techniques of 3D printing. It's called FDM. But aside from the abbreviations or the technical abbreviations, we can name this as a manufacturing technique. So most of them different techniques, but this is one of the most famous techniques. You can see something like a nozzle depleting the plastic layer by layer. So we can call it the additive manufacturing. Why it's called additive manufacturing? Because most of the time, the traditional manufacturing, it's subtractive, as the traditional foam itself, or wood manufacturing, it's subtracting from the material. But when it comes to 3D printing, we are adding the material layer by layer. And this gives us a very wide range of possibilities and advantages. One of the most prominent advantages of this, we call it moldless manufacturing. So we don't use molds, we only use a digital workflow to make whatever the product is. And this technology, it's used in too many applications, starting from toy industry, aerospace, industrial engineering, but we are focusing now in the foam industry, how this technology entering the foam industry. So what is the 3D printed foam? You will find something like this, which is a porous structure like this that mimics the behavior of the traditional foam. The traditional foam that you can find it anywhere in your house, that you are sitting in your car, whatever, you can find that traditional foam. This traditional foam, it's some sort of liquid chemical reaction. That's its manufacturing technique. This is the alternate for this foam. We are aiming to substitute this traditional foam with the new 3D printed foam. This technique and this lattice structure, it can be manufactured only with the additive layering techniques. And we will talk about most of the advantages of this lattice structure, and we will explain what is the lattice structure, what is the advantages of it, step by step. On the left side, you can see some of the lattice structures. We have some names for those lattice structures. This lattice, it contains a cell, and this cell contains a strut. This strut, the cell and the strut, those are the factors that we are playing with. We are playing with this structure to give us the optimum performance, to give us the optimum desired performance. So this internal structures allows us for precise control over the mechanical properties, such as the stiffness, the flexibility, the energy absorption, and we can use this in whatever application that we want. And for sure, that will benefit us in our specified application, which is the seating and adaptive equipment. But that's the core of the technology and the core of the material. It's the lattice structure and how we can mimic or manipulate this lattice structure, how every single strut or cell can change totally the performance and the design and the advantage of this. In this shape, you can see the load versus the extension. The extension, how the material is extended when we add some pressure on the 3D printed part. On the right, you will see three different types of lattices: centroidal, tetrahedral, and Voronoi. Each different lattice, each different cell size differs totally from the other when it comes to load and extension. And I have the seat here. I wanted to show you this seat. This is the 3D printed foam in a seat. You can see this cell structure, it's called gyroid structure. And it's totally different also from those three other lattices. We will get from this that we can manipulate totally the design only by differing the two factors, the cell size and the shape of the structure. This is a small video. I hope it will play quickly. Let's skip the video. It was showing the difference between the traditional foam and the 3D printed foam in action once you squeeze both of the components. But when it comes to 3D printed foam, we mention those 6 items for the features. Those are the main items generally using the 3D printed foam without mentioning the application or the positivity of each one in the application. So the first of all, we are talking about the personalization. Any 3D printed product or any 3D printed foam, it's totally customized, customized according to the body shape, the structure. It can be manipulated totally to fit someone because we have a general rule. Comfort is personalized. It cannot fit everyone. What fits you doesn't fit someone else. And the second one, it's the breathability. You'll find it. That's the skin structure of the 3D printed foam. It allows optimum flow of the air, and this allows for a very good advantage in most of the applications because the airflow is crucial when it comes to the skin integrity, the heat accumulation in the body. The second one, it's the multiple hardness zones. If you can find something like this, that's foam part. The stiffness of the foam part, it's equal in all of the areas of the part. It's equal here and here and here. The same stiffness, the same flexibility all over the part. When it comes to 3D printed foam, you can manipulate the zones. You don't have to make it in 2 parts, just the same part. You can make one of the parts extremely hard to give you the support, to give you the structure that you need. And some of the parts, you can make it extremely soft, thus to give you the squishiness. And when it comes to seating, for sure, we are using this to make the pressure distribution and the relieving of some crucial parts according to the input of the experts and the seating experts and the physiotherapists. This material, it can be washed in the machine. It's machine washable, but the most important that it can be washed up to 60 Celsius degree, which is totally different from traditional foam. When it comes to traditional foam, it absorbs the water. Once you put it around water, it will absorb most of the water. But when you compare it to 3D printed foam, you will find it, as we call it, moisture wicking material. Moisture wicking, it repels the water. It repels the water as quick as you can. So if you throw it in the washing machine, it can withstand up to 60 Celsius, which makes it antimicrobial, antibacterial. And this one of the crucial advantages that can be used, maybe like patients with incontinence, they are using this, or just dirt in the daily use. It's very usable. It's very usable and very beneficial. And this one, we talked about the personalization, how the 3D printed part can conform to the shape of the body. Our bodies are not the same. When it comes to accommodating someone, we need to take the exact shape. But when it comes to customization and 3D printing, you can totally customize it. Where the bones are, you can customize it according to the seat bones, the trochanters. Those areas need to be very soft, but this is totally personalized and customized to this specific patient. This cannot be done with the traditional ways or the traditional techniques. So if we are talking about the seating challenges, as Mostafa said, we have 4 main challenges that we are trying to hit when it comes to the seating with the traditional foam. The first one for sure, it's the posture control, which is, as we saw from the presentation, it's very crucial when it comes to the healthcare and well-being of the patients. You need to maintain your posture 24 hours, not just 1 or 2 hours in some activities or something like this. you need to maintain this posture and to keep it in the optimum posture and to be controlled all over the 24 hours. And you have to revise your expert. The second one, it's the pressure injuries. And the pressure injuries and ulcers, it's very risky. It's not only injury. It can cause a death if you leave it without any control or supervision. So you need to keep your eye on it on a daily basis. So we need to make some sort of a prevention before this. And the third one, which is one of the reasons of pressure ulcers, is the heat buildup, which is one of the disadvantages of the traditional foam. If I asked any one of you sitting on the ordinary traditional foam, ordinary chair, by time after 30 minutes, you will find yourself accumulating heat. That's one of the features of the traditional foam. But when it comes to 3D printed foam, it enhances the airflow, so it dissipates the heat. And the last one, it's the durability and care, not only for the wheelchair users, but for everyone. If you are looking for a traditional foam piece, after time it will lose its shape. When you are giving it some sort of a load or weight, after some time it will lose the shape totally. But when it comes to 3D printing, after some testing and some validation with the quality control, it shows that it's 2x the lifespan of the traditional foam. 2x, which means if it takes around 6 months for the traditional foam to lose its shape, it will take 1 year when it comes to 3D printed foam. And this is crucial when it comes to, because it's some sort of investment when it comes to seating equipments. It's an investment for the family, for the caregivers. So it has to be value for money for a long time. So let's see how the 3D printed foam specifically in this application will solve each one of those challenges. So the first one, it's the pressure distribution. When it comes to pressure distribution, it's one of the main tasks or the design considerations that we take when we are designing a seating system for one of the patients or the child. So how we can make this in the optimal form, how we can make, as you can see in the picture, it's the results from a pressure mapping. It's some sort of a pressure mapping session that we will discuss it in details later on. But this shows where is the pressure accumulated. As you can see on the left side, the pressure is totally accumulated on the right. So the patient or the one who is sitting on the pressure map is totally tilted on the right with a pressure on this area with a very with a very big risk of having a pressure ulcer or some injuries or redness in this area. So our task was to distribute this. How we are distributing this? We are taking the advantage of the multi-zones. So we are making the multi-zones spreaded. So the area under the seat bone, we make it extremely soft, and then gradually we graduate until we get out till the outer solid structure, which is nearly plastic foam, which is, you can tap it like this. But inside, which is interfacing the body and interfacing the bones, you can find the most soft area. Just to give you the result on the right. That's the result. And that's the shape that we are looking for when it comes to pressure distribution, to just distribute the pressure and to minimize the maximum pressure, which is the red spot. The red spot means that this is the maximum, and the maximum is underneath this bone. So we need to minimize the maximum pressure and to distribute it all over the area of the body, contacting the seating system or the cushion. This one, when when we talked with the caregivers and the parents, we thought that one of the most important issues that they are facing is the issues with the pressure ulcers or the posture control, those main issues. But we found out that this is one of the most important issues that they are facing, which is the growth rate, and this is all about the pediatric physiotherapy. They are dealing with childs, and when it comes to childs, we have a big problem, which is the growth rate. And when it comes to growth rate, the parents, they are investing in a seating system, a huge amount of money. And when a child is the 3 or 4 or 7, his body changes totally. And if he's going to a surgery, if his status changed dramatically, so he will need totally another wheelchair, a totally different wheelchair that can accommodate his new status. And when it comes to 3D printed foam, we are using the feature of recyclable material. This material, it can be totally recycled. How it can be recycled? This material, it can be shredded into pieces and it put into pellets, small pellets. Then it comes back to the starting foam. So we can make another totally new wheelchair, which fits the new size and the new state of the child. So we can use this to make it even with a discounted price, because we are cutting the cost of the new chair. So it can be made even with a subscription model. The next issue that we saw from the parents and the physiotherapists and the caregivers, that the integrability. The seat is not integrable with most of the solutions that are available in the market. So most of the childs, they come with a seating system. They already bought a seating system, and that's it. That's our current seating system. How we can enhance it to be better. Most of the solutions, let's throw this away and let's get totally new seating system to accommodate the new status of your child. But when it comes to 3D printing, it can be integrated. You can integrate your current seating solution. You can use it only, you can call it as a frame or something like a transferable wheels, but the cushion or the seat that's facing the child, it can be totally accommodated to make it and change it into adaptive seating. So when it comes to like the picture on the left, it's very fancy electric wheelchair, or on the right, it's a very cheap brand for wheelchair. Both can be accommodated to be adaptive wheelchair according to the needs and the status of the case, according to this moment. And it can be recycled, as we discussed before, to the new current. So it's totally dynamic, totally adaptable according to the case. When it comes to the posture control, the challenge of the posture control, the main advantage of 3D printing, most of the process is done digitally. So when it comes to digital workflow, the mistakes are few. You can make a surface that it conforms the spine or the pelvis of the patient totally. So you are ensuring that this is the optimal alignment. So that's why we trust the 3D printing and trust that this is revolutionary, that will transform the traditional ways from the plaster traditional way of making plaster mold and taking the shape without taking into consideration any digital workflow with tight tolerances to correct the posture with a very tight tolerance to make sure that everything conforms 100% to the shape of the body according to the input of the physiotherapist. And that's the crucial part. We have to look and collaborate with the physiotherapist and the expert that's dealing with the family, who knows exactly what's the shape and the maybe a scoliosis with a degree, with a very tight degree. We need to accommodate, we need to correct. What's the degree of correction that we can accept in this case? So we did this as a digital workflow. And when it comes to digital workflow, most of the outcomes and the results are with a minimal error degree compared to traditional methods. So I will take you now to the steps to make this customized product. We will just take a quick tab into each step. What is the this feature, how it's done, but with a quick tapping to each step in the process, just to know how to make the this technology into action, how to convert the design into a final using seating technique. We have 4 steps, which is the pressure mapping. The second one, it's the 3D scanning and the vacuum mat. That's the green mat in the picture. The third one, it's the design and the different hardness zones. That this part is totally, we call it a review with the physiotherapist or the owner of the case who knows the history and the medical history. He talked with the family. And the last step, it's the printing, then the fitting again with the patient. The first step, it's the pressure mapping. We call it like a quality assurance when it comes to fitting, when we finalize the seat. And when it comes to the first time we see the patient, we are discussing with him what is the performance of your current seating. He is coming with the seating solution. That's it. I'm using this. How this seating is performing according to the numbers, not by just visual seeing. We are collaborating with the physiotherapist to give him a numerical representation how his seating is performing according to some numbers. But you just need to know what is the pressure mapping. It's some sort of a thin fabric, just sensor fabric with a matrix of sensors, around 50 by 50 sensors, covering most of the areas of the bones and the muscles when you are sitting. So it's a matrix, a matrix of sensors accumulating to give you this informative color-coded results with some numbers, which is measured by these sensors in the matrix. So we can just check some of the numbers, right, to check what are the factors that this pressure mapping session is targeting. The first one, it's the average pressure. So when it comes to the minimum and maximum, we need to know the average, the minimum, and the maximum, which is what is the maximum value that this patient hits in this time after sitting for 4 or 5 minutes, or average 5 or 7 minutes. What is the maximum pressure, the minimum pressure, and the average? And for sure, our target is to minimize this number as much as we can. Second, you will find pressure deviation, the standard pressure deviation and the median pressure and the median pressure. Those are how he is shifting, and once he is shifted, how much the pressure is deviated from the maximum to the minimum. Then we will find the contact area, and that's very crucial factor when it comes to designing a seating system. We are trying to maximize this factor as much as we can, because we need the contact area with the seat or the cushion or the back to be maximum, because once you have a bigger area contacting the cushion or the back, that will distribute the weight, that will distribute the pressure, it will take much load, it will just deviates the moment of inertia of the body. So we need to maximize this area, the contact area. And the estimated force, that's force of the body in newtons, and it's not crucial in the design, but it's a figurative number just to get to know how the body is acting, as the graph that we saw from the slides back, the load versus the extension. And this is the pressure mapping in a nutshell. Then the second step, it's the vacuum map and the scanning. The vacuum mat and scanning. This vacuum mat, as you can see, it's a very soft cushion, and this cushion is mainly used for taking the impression and taking the shape of the body. But when it's very important because this is very malleable, very soft. So the one who was designing the seat, he can just shape it according to the optimal posture that he sees is the best to fit this patient in this status, according to the wheelchair, the armrest, the headrest, and also the footrest, which is also very important. But this green part, you can just think about it as a very soft thing that you can shape around the body to just put it in the fixed posture that you want to be some sort of the mold as the traditional foam. But this is you can suck the air from this vacuum mat. Once you suck the air from the vacuum mat, it's rock solid. And if you inflate some air into it, it's malleable again and very flexible. So you can feel it once in a hands-on workshops. But this one is very crucial when it comes to designing the seat. And this video, it shows the scanning process. Once you have the vacuum mat in place and you have the child in the optimum posture that you see that this is the best, you can just fix it and suck the air, and then the step of the scanning. When it comes to scanning nowadays, it's not a very big deal. You don't have to buy a very costly initial investments and 3D printers, 3D scanners, sorry. But for now, you can just attach some sensors to your iPad, and you can take the advantage of the whole digital workflow. You can convert your iPad or even your iPhone, taking the advantage also of the face camera. So you can just convert your iPad or iPhone into a handheld scanner that can take the shape of the vacuum mat as desired in just around 20 to 25 seconds. And this one, and it will be in the pipeline for the digital workflow. This step, it's the digital design. After we finished the pressure mapping, the vacuum mat, and we take the impression of the patient, and we took the scanning with the scanner, handheld scanner, or the iPhone or the iPad. That's the output of the 3D scanner. That's purple shape, that 3D model. Then the third process is the digital design. When it comes to digital design, we have 4 or 5 factors that we are tackling, but the most important that we need to do this in a collaboration with the physiotherapist. So it will be a tag team between the 3D printing specialist and the physiotherapist or the seating expert to get the optimum results, just to make a review and check in every step. So the first step will be examining this scan. Is this scan perfect as we thought in the assessment and in the vacuum mold? Then the checklist, okay, this one is very good. Then it can be taken into some sort of another digital workflow. And nowadays we have AI tools and AI techniques for making this process almost 90% automated by taking this scan and push it digitally into a pipeline, AI pipeline script that can give it the optimal posture. It can recognize the spots that accumulates the pressure and give you the recommendation. And after you have this automated recommendation, here comes the input of the seating expert or the physiotherapist. That's the human interfere. We need some input from human just to accommodate this according to how he knows his patient, his case, and even how they use the wheelchair. For sure, this cannot be done by AI for now, but we hope in the future it can be 100% automated and we can use our human intelligence in something else. So the steps, as you can see in the pictures, the 3D scanning, the upper picture, it's the multi-zones, and it's very important also. It's a very important step just to take into consideration which parts will need support and structure, which part needs to be very hard, and which parts need to be squishy, needs to be medium, not sure. So we have, when it comes to different techniques of 3D printed foam, we can reach up to 7 degrees of hardness, 7 degrees of different hardness zones, from totally plastic feel to the feel like memory foam. That's the, in a nutshell, the design process and some quick taps into it. The last step, it's the 3D printing. I have a quick video here that shows, for anyone who doesn't see this before, it's, as we said before, it's a layer by layer manufacturing process. So that's how the 3D printing process is done. After we finish the pressure mapping, the assessment, the vacuum mat, and the scanning, and we finish the design, we put this file into the printer to the G code just to make this layer by layer up until it finished the whole design. And after this step, we have the fitting step, which is some sort of a quality control step when we take the 3D printed chair with to make the fitting with the patient and to see with another before and after pressure mapping how we did in the design consideration, in our design goals, how we leveled the patient, how he is balanced, how he is the 50-50 balanced or almost 60-40, how much we reached our goals in the design. I need to take some few minutes for some of the showcases without showing the faces, but just to take the idea of the case and to take a feel how the showcases. The other showcases, we are taking some showcases from childs from outside, but for now in UAE, this technology is used, and it's making seating systems with 20 plus cases, and it's showing very positive results and inputs. So that's one of the designs. As you can see, this is the scan, and the child is wearing a brace with cerebral palsy. And we have mentioned here that he is using a cushion from another manufacturer, which is a traditional foam, the one in the like the oval shape. And this cushion is totally off-shelf size. It does not conform to his shape. It's not mentioning just off-shelf product. So we did a customized cushion with 3D printing. As you can see, the 3D printing, how 3D printing is changing dramatically the pressure distribution and the balance before and after. And as you can see, the comparison is not just a feel or just a visual input, it's a numerical input when you are comparing the 3D printing technology and the traditional foaming. One of the other techniques for making the 3D scanning and the mat is the offloading technique. When it comes to some rural areas they don't have access to some of the equipments that we are using for the assessment or for the impression, we can use this offloading technique. And this offloading technique also, it's giving a very good results in this position, the 90-degree, the stomach facing the mat with the scanning inverted. And I need to discuss also some of the applications aside from the seating solutions for the wheelchairs, as mentioned before in Mustafa's presentation, we have not just only the seats, we have 4 or 5 sectors that we need to tackle. That's the adaptive seating, the sleeping systems, the bath equipments. So it's not, and the transportation for sure. It's not only the seating in 4 or 5 hours the day. It's a 24 hours control. So one of the applications of 3D printing is the adaptive car seats. When it comes to transportation, it's one of the heavy nightmares of the parents and the caregivers. It's the transportation in a train, in a car, in a very long or short period. It's a very, very heavy task. Taking a child with CP or any other, or autism or whatever, taking him in a trip, in a long trip or short trip, it's a very heavy task. So here comes the adaptive car seats. The adaptive car seats, it accommodates the size, it accommodates the case, it can totally keep him safe. And this tested with 3D printing, and it gives very good results when it comes to fidgeting and the movement in the car. And for this, it's a sleeping system. It's a child in a coma with the customized, totally customized. As you can see, it's the same material, the 3D printed foam, but it's totally customized to the shape of the child in the coma because they need him in this position. But this is not helping him when it comes to pressure ulcers and to the posture and the stiffness. So here it comes the totally full customized sleeping system that's accommodating his shape and body. And that's one of the examples for the bath and the showering products. The hard shell of the showering bath is padded with a 3D printed foam. It can benefit the patient in too many aspects. One of them, for sure, it's the multi-directional deep cleaning. You can just use the water upside and downside. It's totally moisture wicking material. You can just play with it whatever you want. It's more safe. It's containing the patient all over the cleaning process. It's more convenient. So it's ergonomically designed to be in the most convenient way to help the caregiver to give him the proper hygiene in without any stress, without any pressure. Just put him in the pressure relieving posture and give him it can be a very good time, not only a bad time. It's some of a play time. And that's it. And thank you very much. Thank you very much.
Thank you, Ahmed, for the great presentation. And I think now this is the time for discussion. If anyone has a question, we are open to discuss it all together. Right now, we received 2 questions. The first one is, what can we do for a child who has epilepsy and it's not controlled even during eating at nursery? He start to move in jerky movement. So we don't have golden standard for something in the adaptive seating. So if we want to talk about the epilepsy, first of all, you need to go back to the doctor and check his condition and check his medication, because the adaptive chair is just an equipment. So if you have anything beyond the ability, then we cannot guarantee that he will be in a good position while he's having epilepsy. But the question now, if you have a child with epilepsy, or you know from the parent interview that he has high tendency to get more than one epilepsy per day or frequent epilepsy per day. What are the consideration in the chair? First of all, the safety is our priority for this child. So you need to consider a chair with a good base and anti-taper wheels, because if he had that kind of epilepsy and he gonna push himself back, so you need to secure him. The second is you need to consider um, a full back reclination in the chair, because if you are outside and you cannot move the child out of the chair quickly, then you need to open the chair completely. So you need to consider this in the chair. Also, for the pelvic belt and the edge belt for the trunk, you need to consider it as easy detachable. So you can, if you feel that the child is going to get epilepsy, or you see the epileptic fit, then you need to move him completely out of his chair and to do your first aid with him. So you need to consider easy detachable belt for him. That's my consideration. But again, I will say that if it's something beyond, and if the epilepsy is not under control, then you need to go back to his doctor first. So the second question is, it seems like a complex question. What is the best what is the best adaptive seating system for 4 years old hypotonic CB girl with GMFCS level 5? And could you please tell us a brief case study who take the benefits of 3D adaptive seating system and how you split the rules between both of you?
That's 4 questions in one question.
Yeah, exactly. So
we can start with splitting the roles, the whole journey from first.
Yeah. I think I will try to minimize the answer and make it for one case scenario, because it seems like it's a case scenario.
Yes.
So who can benefit? Yes, this 4 years old with GMF level 5. I will put assumption right now, because it seems like it's a case scenario. We don't have accurate and the full information about the child. So let's say that a 4 years old girl with hypotonia, mostly she does not have good head control. She has muscle asymmetry over the trunk. She might have tendency for kyphosis and posterior pelvic tilt and external rotation in the hips. This is assumption. So let's say that we got this information, and let's say that all of this are like flexible. So we can correct everything. So we will consider, we don't know about her cognitive ability. Like, she's level 5 because of the cognition is included. She has limited cognitive ability. She can express her pain and she can communicate or not. But let's say that she cannot communicate and she cannot express her pain. So for me, I will start my part, and I think Ahmed, you can continue your process. So for me, after the parent interview, after the information that I assume it right now, I would say that this child might get benefit from adaptive seating, which is cushion supporting the pelvis into natural position with a little bit lumbar extension. And I would say that the back angle of the seat could be 95 because we need a little bit back reclination just to support the posture and to keep the communication and the eye level for the participation in what she's doing. I would love also to collaborate with and ask the feeding therapist if she's receiving feeding therapy and the occupational therapist to listen to their needs in her current chair. And then I will ask Ahmed to come and to provide a cushion with back open to 95.
95 degrees.
Yeah, with lateral support, and actually the height of the lateral support, it will depend on the control of the trunk. And from here, Ahmed, he can start his process.
Okay, we can have a golden rule when it comes to the 3D adaptive seating. It's totally customized. It's totally personalized according to the case. So when it comes to the journey, how we split the roles, it all starts with the physiotherapist, with the seating specialist. He gives the assessment, that's the medical history, that's the status, that's the simulation of the body. This is the case. Then we will conform this and we test the quality and the performance of the current seating system with the engineering tools. That's the role of the design engineer. Then the pressure mapping. Then we assess each other in the vacuum impression. That's a teamwork when it comes to the vacuum impression. Then the design part, it's also a teamwork, but digital. It's a digital review part when it comes to changing when it comes to correction. In some cases we don't need to correct, we just accommodate the case, and that's it, not to be progressed in another worse scenario. So that's a brief in the journey. And when it comes to the fitting also, we make the before and after pressure mapping to see how the design comes in reality.
Yeah, and again, after the child, this 4-year girl, received her seat, we're gonna revise her sitting position, and for example, for the adductor separator or the lateral separation, we will ask her parent from the beginning how they move her out of the chair, because if she's at any way can be shifted or slided till the end of the chair and put some weight on her leg just to rotate her to another chair to prevent the full carrying of her caregiver, then we need to consider this as well in the cushion itself. So that's regarding this question. I hope we answered the question. So we have another question. I think me and you, Ahmed, we can answer this regarding the 3D printed sleeping system, especially if the case is chronic. How do you approach the need for frequent position changing since the mat itself is shaped in one position?
So we will go again to the general rule. It's totally customized according case by case. The case that I showed in the presentation, the case needed to be positioned in this position because that's the optimum and the best. When it comes to another cases, we can make it just not deeply contoured like this. It can be slightly contoured. It can be equipped with air, supplying air and airflow. It can be equipped with some gel elements. It can be customized according to the case. You can think about it as malleable part, but you can shape it as if you want. So it's not mandatory to make it shaped. It can be shaped totally according to the case. It can benefit from the airflow, the multi-stiffness zones, and
yeah, and I think there are also multiple designs of the sleeping system. So one of them, and also it will depend on the initial consultation, but it will depend on the case. If you need to reposition more than one time, then they will consider the sleeping equipment as different detachable board. So if he will be on his back, then he will arrange this in the mat. And if he need to turn to the right or turn to the left, then he will detach the caregiver, of course, for these chronic cases. He will detach this part and move it to realign him again. So there are more than one design for the sleeping system. The
yes,
third question is
that's totally
revising.
free. 90, 90, 90.
Yeah, revising the 90-90-90 posture is essential, but it's equally important for transition toward comfortable and pain-free posture management. I would like to hear your clinical perspective on how to balance therapeutic goals such as promoting alignment and symmetry with the individual need for comfort and functional ease. That's a very good question. Okay, so we have two scenarios right now. The first scenario, that this child with his condition and his alignment can accept this position. And the other, he does not have the, the musculoskeletal abilities to accept this position. Like he has muscle contraction, muscle tightness does not allow him to sit into this position. So for this one, if you put him in this position, he will not be comfortable and he will not be participating in what he is doing, and the alignment will not be perfect for him because it's not suitable for his musculoskeletal system. So for this scenario, we cannot say that this child sit and he will be functional and he will be active, and we will not get what we want from the therapy if we put him into this position. Okay, let's go back to the other scenario, that I have a child who can maintain and sustain this position. Then let's say from our protocol, we can say that if this child during his therapy session, we can mix ما بين tilting in space, okay, or the back reclination and disposition. So we can advise the caregiver, or we can collaborate, for example, with the occupational therapist after giving a good lateral support and a good trunk support, like good proximal stability. We can coordinate with the occupational therapist to put this child in this position, like for 10 to 15, and then change the activity and change the angle of the chair. We can tilt it in space just a little, like we can maintain this position and tilt it in space just a little during the session, just to relieve the pressure. And then after 5 to 10 minutes, we can put him back again into the same position. So in that scenario, we can get the therapeutic goals and we can get the functional ease of this child. So that's my point generally.
Oh, that's another question.
Yeah, we have.
What factors should be considered when prescribing a seating system for a child with scoliosis and cerebral palsy?
Okay. So
We can answer this from the two perspectives, from the physiotherapy perspective and the engineering side and the design side. Yes. What should be taken into consideration?
start, Ahmed, if you want to answer from your point of view.
Okay, when it comes to what we take into consideration when it comes to design, from our side, the first question always is the child wearing a brace or not, and how long he is wearing the brace. That's the most common issue and the common challenge that we are facing. How long he will be wearing the brace, and is he wearing a brace or not? Because this affects the seating system and the design of the seating system. Because most of the time, some of the cases they are wearing the brace maybe for 20 hours a day. We are just taking it off for 4 hours during sleep. So in this case, we need to conform to the shape of the brace. In some cases, just wear the brace 2 or 3 hours, 4 hours. So we do some sort of two seats, one which is a cushion, and that's totally according to the recommendation of the expert. You can call us as the transformation. We take the recommendation of the physiotherapist and we transform it into a designed product. So that's the one of the main factors. And second, the environment, how the child, what's the activity of the child, just to take this into consideration, and the seating system itself. If the child is using a current seating system, what are the dimensions, the growth rate of the child? We need to take those factors into consideration. Those are the most important factors in from the perspective of engineering and design.
Yeah, and also I will add on what Ahmed said that we need to consider his condition. So we know that we have children with high skin breakdown and they have respiratory problem, which is not allowing them to sit with the brace. Um, the brace will be not the best option for them. So in this case scenario, I would prefer a fully adaptive, customized and molded seat, complete seat for them. It will serve the same and it will help him the same like the brace will help them if their case is complex. So I believe that the collaboration is the best to get point of view from the orthopedic doctor, to get a point of view from the orthotist, and from the equipment supplier and from the engineer, and we will all sit together to set the best for this case. One more question is, due to prolonged sitting in the chair, maybe the child produce iliopsoas tightness. How to avoid this point? The answer of this question lies in the last step and the final step of uh, the seating consultation. After you provide the equipment and the chair, I said we need to set a protocol. One of these protocol is the transfer and changing position to prevent this tightness. And again, I would say that the seating adaptation is one of 5 from the 24-hour postural management. And we have in this items the standing frame. So we also, to avoid this, we need to consider standing time. Standing time maybe in stand frame, maybe just at school, like you can prescribe for a child who's sitting on a chair and he can actively move himself. Just at school, he can put his hand on the table and stand. If we go back again for 5 to 10 times. So I believe that the protocol, the right protocol for the chair and the exercise and the collaboration of the physiotherapist, if you are not the physiotherapist who's treating this case, will be the best option to avoid this point. I hope we answered all of your questions.
Most of the questions, yes.
Yeah. But if any of you have any,
If you have any other questions, just we are here.
yeah, yeah. So thanks for your participation today. Thank you.
Thank you so much. Thank you so much.
Okay, so thanks for today, and we will be always open for any advice. So at any time, if you needed any advice, we are always here.
Sure.
Yeah.
Thank
So
you.
thank you. And
We appreciate
see
your
you.
time. Thank you.
Thank you. Thank you so much.
Give me an update.